วัสดีครับ Good morning all training participants on behalf of Biomedical Engineering College of Rangsit University. We are honored and would like to thank everyone who under the College of Biomedical Engineering at Rangsit University in participating in the training and sharing experience regarding the transformation of medical device and healthcare technology at this time. Organizing the training projects will not only allow for the exchange of knowledge and experience in the transformation of healthcare technology, but also exchanges in the culture and nature for each continent and region are likely to occur, which will affect collaboration in other areas of biomedical engineering related to each other in the future as well. On behalf of the Dean of Biomedical Engineering College, Rangsit University, I would like to welcome you all to the exchange of challenges experience for the topic that will be exchanges with all honorable people paradigm shift in public healthcare. Furthermore, I would like to introduce about the scope of presentation today. Today, I would like to present about the first topic is the introduce College of Biomedical Engineering at Rangsit University. Next, I would like to introduce paradigm shift in healthcare. After that, I will talk about the big impact of paradigm shift in healthcare landscape, which composed of impact of paradigm shift in healthcare on the role and status of biomedical engineers, impact of paradigm shift in healthcare in medical device and healthcare technology, impact of paradigm shift in healthcare on biomedical engineering profession concerned with medical life cycle, impact of paradigm shift in healthcare on biomedical engineering education and standard of biomedical engineering manpower, impact of paradigm shift in healthcare on the healthcare services, impact of paradigm shift in the life expectancy of the world population, and the last topic I would like to talk about the impact of paradigm shift on the elderly era. However, first, let me briefly introduce about Rangsit University and the College of Biomedical Engineering as follows. Rangsit University is a private institution of higher education. Rangsit University has a long history, has been running since 1986, and now we have known a private university which has rated its very good standards from National Education Standard and Quality Assessment. For the located of Rangsit University, Rangsit University is located in Pathum Thani province in the central part of Thailand. A distance of only 3 kilometers from Dongmueang International Airport. Rangsit University is primarily aimed at creating graduates in the area of study meeting the requirement of national development by focusing mainly on trial, technology, design and management, including independent professionals, which are requisite in development. Now, Rangsit University has worked out academic cooperation with leading institutions and universities from various countries, such as USA, UK, Netherlands, Germany, New Zealand, Australia, Switzerland, Belgium, and some outliers. About the administrative structure of the faculties in Rangsit University is divided into a cluster of faculties as shown below. For the slide, you can see that the cluster of faculty and college in Rangsit University composed of faculty of group of faculty of medical and health science, group of faculty of engineering and technology, group of faculty of humanity and social science, group of faculty of art and design, conservatory of music, faculty of economics and business administration. For the college of biomedical engineering, it belongs to faculty of medical and health science. College of biomedical engineering, we have been running since in the year 2002. At the beginning, we are just one program in the faculty of science. Later, Rangsit University restructured by raising the level from a program to a faculty, and later became to the College of Biomedical Engineering as is today. There are details for each milestone as shown in the slide. From the slide, you can see that in 2002 to 2011, we are produced the graduate in terms of Bachelor of Science in Biomedical Engineering in the Faculty of Science. After that, in the year of 2012, we changed from Bachelor of Science to the Bachelor of Engineering in Biomedical Engineering, but we are belong to Faculty of Science. And in the year 2015, we had been running the master program in Biomedical Engineering. However, in the year of 2016, we changed from the program in the Faculty of Science to be the Faculty of Biomedical Engineering, and later in the year of 2018, we became to the College of Biomedical Engineering as it is today. And 1 year next, in the year of 2019, we had been running the Doctor of Engineering program in Biomedical Engineering for the staff member. Now, we are academic staff about 19, with comprising of 1 professor, 5 associate professor, and 9 assistant professor, and 10 of PhD staff. About the amount of students, now we are the current student about 450. In the past, we have the alumni around 560, composed of foreigner, about 50 foreigner, Thai alumni, about 519. For the graduate program, now we have the current student about 61 students in master and doctoral degree. The College of Biomedical Engineering, Rangsit University, emphasize education by emphasizing learning outcome by using a research-based and project-based teaching and learning process for the student development. We have national and international program in the bachelor, master, and also doctoral degree. For the research field, the research of Biomedical Engineering College, we focus on 3 main tracks. The first is the medical device and robotics. Second is smart healthcare technology and clinical engineering. And the last is the biomaterial and tissue engineering and biosensor. Now, we have the 7 research labs. The first is the clinical engineering innovation lab. Second is a medical robotic lab. Medical signal and image processing lab. Laboratory innovation of biomedical and health informatics lab. Biomaterial and tissue engineering, biomedical instrumentation, and BIS Center Research Lab. For the collaboration, we have collaboration with also national and international institute in terms of private and public sector around the world and around the country. In this slide, I would like to talk about why healthcare must transform. In my view, factors that affect every dimension of operational strategy, including public health care, in today's world, are like to come from the following factor. From the slide, you can see that this is the factor which drive the healthcare transformation today. You can see that the factor which drive the transformation of healthcare composed of aging society, globalization, and technology disruption. Or we can talk at the rapid technological changes. This slide shows about the important factors driving change in medicine, which is the internet. You can say that in the pre-internet era, which is the conventional medicine paradigm, everything complete reliant on doctor, including first opinion, second opinion, data, and process optimization. But after discover the internet since 2002 to the present, everything has changed from complete reliant on the doctor to the other, because the development of technology come from the progressing of internet, especially when we cover the AI technology. In this slide, I will present the more reason with supporting about why healthcare must transform, including rapid technological changes, increasing complexity of devices, shrinking staff numbers, public demand for more control over healthcare, global markets, and global regulation, and absolutely, people will embrace health as a personal attribute. Quality will be given, efficiency will be the rule. Individual will own and manage all of their data. And also, trusted health information will be the new currency. The results of the above mentioned factors had a wide impact on stakeholders, patients, the public, operators, administrators, and policymakers, both at the national and international level. One important factor is the World Health Organization's shift to a new paradigm for healthcare in the 21st century by setting up a new workforce strategy for healthcare, which we call Workforce 2030. About the important issue of Workforce 2030 strategy is improving health outcome, social and economic by ensuring the availability, accessibility, acceptance, coverage, and quality of health workforce through adequate investment to strengthen health system and implementation of effective policies at national, regional, and global levels. The second issue is improving participation of all professions in public health services, especially biomedical engineer become to be the medical staff following the Workforce 2030 strategy. From what has been presented, it can be seen that the old era of medicine or volume-based medicine was used long before the development of internet system, where everything depends on medical personnel, which composed of doctor, nurse, and pharmacist. Therefore, if written an equation, it can be seen that the result of the quality of the process will depend on three variables as shown in the equation. But after the changes in the technological landscape, especially the invention of internet and the advancements of communication technology, coupled with information presented before, it is evident that there are limitations of the old medicine that many were unable to answer, various challenges that can be challenged in today's era. As a result, there has been a paradigm shift in healthcare. The new paradigm of modern medicine emphasize on patient center throughout the lifespan of the people. This is in response to the issue of time, access, safety, equality, and equity, efficiency, and effectiveness in healthcare, which we call value-based medicine, which can be summarized in the equation as present. From the paradigm shift in the healthcare, it caused a transform in all process of healthcare, which are shown in the slide. From the slide, you can treat that the process or processes transform from the fragmented to integrated and automated, from invasive to less invasive, preventative and immediate based, transform from provider-centric to be patient-centric, from centralized or hospital to be decentralized and shift to community, change from one size fits all to personalized vaccine, change from therapeutic diagnostic devices to be theranostics, change from treating sickness to be preventing sickness or wellness. Furthermore, the paradigm shift in medicine or in healthcare will have far-reaching impacts from global organization to countries, from the policy level to the operational level in all sectors. What will healthcare of the future be? In the near future, the healthcare will be the following information. The following. First, healthcare is information business. The new healthcare transform into organization where decision making is based on evidence and data-driven insights. The new healthcare transforming the who, what, and where of care delivery. The new paradigm of healthcare transform from a passive role to the active role in health. The new healthcare paradigm concerned with the enabling proactive and precise medicine or precise treatment. This is the example of the landscape of the healthcare in the near future. You can see that the welcoming patient to the hospital to digital front door. It will have keeping a caring eye on patient from the hospital to the home. It will have improving access to care around the world through virtual collaboration, and also it will have virtual imaging operation in the cloud. So the digital data-driven healthcare enterprise will be found easily in the future. Moreover, the technology concerned with the forecasting and managing patient flow will be found in the near future as well. Furthermore, about the extending critical care capacity across location, we will have in the near future as well. The impact of paradigm shift in healthcare in medical device and healthcare technology. From the slide, please considering the objective of the new paradigm that emphasize time, access, safety, equality, and equity, including efficiency and effectiveness in healthcare. Therefore, the life cycle process of medical device and healthcare technology must be intelligent and serve the purpose. Medical equipment and healthcare technology life cycle must be changed from standalone to device that can connect it to the internet and communicate between machine and machine, can communicate between machine and human, and also they can be predicted or predict the future as well. From this slide, you can see that at the era of the healthcare, medical equipment and technology must change to meet the needs of patient-focused healthcare. So all of technology in the future must be respond to personal life, must be connected, must be integrated for the trend of innovations of the innovation impacting healthcare era are as the following, as I present in the slide. On the slide, you can see that the trend of innovation must be miniaturization, implantation, smart device, hybridization, networking, informatics standard, clinical process, re-engineering, molecular and nanotechnical engineering, virtualization of care away from hospital, point of care labs on chip, material science, interoperability, clinical research support system, telehealth and wellness model of care, new research method based on a new sources of data, design and performance analytics, software evolution, personalized medicine, interdependencies, wireless and mobility, wearable technologies, cybersecurity, and somehow like that. These are the trend of technology, which will be found in the near future. This slide shows about the impact of paradigm shift in healthcare on the role and status of biomedical engineers. As you know, if we consider from the equation in the left-hand side, we did the old healthcare era. It can be seen that medicine in an era that can focus on treating patients will give importance to treatment in volume terms. It is sometimes we call medical staff center. So the other personnel, including biomedical engineers, will only work behind the scenes or work like a shadowing of doctor and nurse. After the paradigm shift in healthcare, the paradigm shift in healthcare delivery towards patient center has restructured the dynamics of the relationship between patient and the provider, and it allowing patient to play vigorous role in safeguarding their own health. From this concept, it is evident that the important transformation in access to the healthcare system, including the emphasis on time, access, safety, equality, equity, efficiency, and effectiveness in healthcare. Therefore, for this reason, biomedical engineers have become and indispensable pillar of healthcare process. I did not think and say by myself, but it is confirmed by the World Health Organization, which gives credit to biomedical engineering by considering that biomedical engineering is one of the important process in developing and improving the healthcare and quality of life of the world's population. As biomedical engineers become one of the pillars of the healthcare process, according to the new paradigm, the mission, status, and role of biomedical engineer have become more important and at the forefront of the profession to be to the process of the healthcare. For this reason, biomedical engineers must improve in all dimensions, including mindset, knowledge, and skill in performing work. In this slide, you can see that WHO placed importance on biomedical engineering by considering is one of the professional that is an important process for driving the healthcare of the world population along with the other related professionals. In this slide, we show about the impact of paradigm shift in healthcare on the role and status of biomedical engineer. You can see that the role and duty of biomedical engineers in the era of healthcare involve performing the role of biomedical engineer in all dimensions of healthcare, including interaction with variety of related persons at the present, because now biomedical engineering is considered a profession in the field of engineering already. Thailand, through the Council of Engineers, had certified by cabinet resolution that biomedical engineering is considered a profession in the field of engineering since around 2016. Therefore, around the world, including Thailand, there is a significant increase in demand for biomedical engineers throughout the healthcare supply chain. In this slide, I show about the healthcare provider in Thailand. You can see that in Thailand, there are more than 10,000 hospitals and around more than 115,000 beds around the country. We have 370 private hospitals with about 77,000 beds located in Bangkok, more than 100 beds. Located in Bangkok, about 116 hospitals, and in provincial, about 254 hospitals. And form guideline of ECRI about the ratio of hospital bed to biomedical engineer is approximately 1 BME per 40 beds of hospital. About the situation of Thailand medical device market player, you can see that in Thailand, we have manufacturer more than 700 companies. We have company about import and exporter around more than 5,000 companies, especially for importer more than 4,000 companies. About the demand for biomedical engineer in Thailand between 2019 to 2022, this information from the PhD research. You can see that the demand of BME manpower in Thailand between the year 2019 and 2022, it found that the number of demand tend to be more than 19,000 people staff. This slide shows about the biomedical engineering program in Thailand. Thailand has started producing biomedical engineering manpower since 1980, and until now had certificate, bachelor degree, master degree, and doctoral degree levels. The main objective for producing the biomedical engineering in Thailand are the support the rapid transformation of technology and global economy, to solve the problem of countries' middle income tax, support the paradigm shift in healthcare, and also support entering the era of elderly. Now we have more than 13 universities producing the bachelor, master, and doctoral degree. And we have more than 10 technical colleges produce the BME technician. About the current number of biomedical engineers in Thailand. Now we have biomedical engineering manpower about more than 600. And each year, technical college can produce about 60 about 90 biomedical engineer technician. About the biomedical engineering manpower, I mean the biomedical engineering program in bachelor degree. Now we have about more than 6,000 biomedical engineers at the bachelor degree. And all university can produce more than 600 biomedical engineers per year. And for the BME brain power, there are approximately 600 biomedical engineers at the master and doctoral degree at this time, and the university can produce approximately 50 master and doctoral degree per year. About the promotion, development, and standard quality control of biomedical engineering in Thailand. Because biomedical engineers are professionals that is important to maintaining public health, quality control, and continuous professional development of biomedical engineers. It in all dimensions is of paramount importance for Thailand. There are 3 professional associations and 1 biomedical engineering consortium that play a role in promoting and developing biomedical engineers. In this slide, I would like to present about the professional association related to biomedical engineering in Thailand. Now, we have about 3 professional associations related to biomedical engineering and 1 of biomedical engineering consortium. The first Thai Biomedical Instrumentation Association is, or we call Thai BMI. It is an association that drives human resources development in clinical engineering in Thailand. This association established since 1977. The second is the Thai Biomedical Engineering Association, or Thai BME. The Thai BME Association's main role is to promote the development of biomedical engineering research in Thailand. It be the initiator of organizing academic conference, which have known in terms of BME icon continuously for more than 20 years. And since 2019, it has been certified body of the Professional Qualification Institute to write the preparation of professional qualification certificate in biomedical engineering. And the last is a Thai Medical Device Technology Industry Association, or ThaiMed. ThaiMed founded in 1989. It acts as the representative of member companies that play an important role in the Thai medical device industry. However, we have Thailand Biomedical Engineering Consortium, which it found in around 2005 and 5. In order to meet the royal initiative of Her Royal Highness Princess Mahachakri Sirinthorn to support the development of biomedical engineering technologies to address critical medical and public health problems. about the professional standard certification, we have in Thailand, we have two organizations with concern with the professional standard certification of biomedical engineers. The first is the Professional Qualification Institute, which it is responsible for certifying competence in performing each career in biomedical engineering. And the second is a Council of Engineers. Council of Engineers responsible for certifying the general qualification and competency standard of biomedical engineer. In this slide, I would like to present about the impact of paradigm shift in healthcare in an increasing in the life expectancy of the population. Since the evolution of medicine and healthcare, medical devices and healthcare technology, as well as the paradigm shift in healthcare over the year, the important result is to the world population is the life expectancy has increased significantly. You can see that from the table in the slide. The expectancy of the population around the world, Africa, Americas, Asia, Europe, Oceania, and the world, you can see that the average expectancy of the population had increased significantly. The impact of changing healthcare paradigms on the elderly society. This is due to the increase in human lifespan due to advancement in healthcare in all dimensions, combined with the strategy of the world and various countries in the past that had the view that the world population would to be large, which would affect the overall quality of life, causing in the past several decades, each country had campaigned on the issue of each family with many children will be poor. This campaign had been going on for a long time and had been passed on to many generations until it had become a set of ideas about the living alone or being married, but having no children, or have only one or two children. All of these causes affect the present era, which is that the birth rate is equal to or close to the death rate, resulting in the world beginning to enter the aging society era. This slide shows that. This slide shows the situation of elderly people or senior people in the world society. You can see that from the graph. The graph trend to increasing of senior people around the world. This slide, you can see that the world's oldest population country territory with the highest share of population of people aged 65 and older. You can see that from 2022 to 2050. The trend of senior population is increasing. In this slide, show the structure of population in Thailand. You can see that in the year 2010, the senior people in the age of 80 less than in the year 2040. And the base, this is the base of pyramid. Trend to decreasing, and in conclude, we conclude that in the next 30 years, Thailand will come to the elderly society in absolutely. If an aging society does not have an appropriate strategy and response, it will have an impact in every dimension. More important, it will be impact on the economy and society, both individual and the nation, as well as global society, both in short term and long term. This slide shows about the Thailand profile, which now we have the population about 66 million. GDP around 495 billion US dollar. You can see with it interesting data population growth rates about 0.1% annual change. By prediction, now around in the year 2020, about health expenditure were 4.53% of GDP and are likely to continue rising and reaching to 4.67% in 2050. 2029. About the year 2029, when including the cost of long-term care health expense, including cost up to approximately 7.62% of GDP. This is a problem for the Thailand if we don't have an appropriate strategy and response. It will have an impact in all dimensions. About the situation and impact on healthcare from aging society, you can see that this is the information from the Siriraj Hospital. We did the biggest hospital in Thailand. You can see that in the year 2021, you can see that the birth rate and death rate is equally. How about the result? You can see that this graph. When the age increasing, when the age of increasing, the frequency for going to the hospital is increased as well. This slide shows about the inpatient services. You can see that if the people with have more of the aging go to the hospital, the number of overnight stay is increasing as well. And the last figure, you can see that about the cost per time in Thai baht of inpatient services. You can see that when the senior people overnight stay at the hospital, the cost is increasingly through the increasing of the age. This slide, I will show about the older person grouping. There are about 3 groups of senior people. First is the healthy and independent. Second group is patiently dependent, or we call homebound. And the third group is totally dependent or bedbound. Since rapid increasing of elderly population, Thailand have the strategy for reaction about the problem. The main objective of the Thailand reaction is how to maintain the elderly population to be a power, not burden. About the challenges for biomedical engineering, the challenge of biomedical engineering in and senior society lie in working with medical professionals to develop, to use, to provide, to recommend, and to consult on appropriate medical devices and healthcare technology to enable the elderly to live their life according to their own lifestyle. For the problems faced by elderly are as follows. The first problem is a physiological problem with concern about the finance, about psychological problems, concern about loneliness, social problems, concern on the cause of loss of respect and dignity, about the emotional problems, cause of the problem of mobility, about the health problem, cause of the problem of elder in abuse, crime, about the basic need of senior people. The basic needs of senior people are independent from one's care, self-fulfillment, participation, social and civic needs, dignity and security. About the changing of landscape of elderly care technology. The increasing number of senior individuals global has led to shift in the landscape of elderly care technology. The changing landscape of elderly care is not only benefiting the senior themselves, but also their family and caregivers. Conventional method of caring for the elderly, such as nursing homes and assisted living facilities, are longer the only option available. With advancements in technology and growing emphasis on personalized care, modern healthcare technologies such as modern medical device, ICT technology, IoT, and AI, and somehow like that, are emerging to address the changing needs and preference of senior population. They create new services, model, and promoting community engagement to meet the evolving needs and preference of elderly. These solutions are not only enhancing the quality of care, but also improving the overall well-being and dependence of senior population. So, the technology for elderly care will be technology in terms of holistic care for elderly, because recognition of biomedical engineer by WHO as one of pillar of healthcare can help research and develop new technologies to meet challenges and needs of the elderly. The technology for caring for the holistic healthcare of the senior, according to various purposes, should be as follows. You can see that we have to develop the technology for improving access to care, smart home solution for social engagement and mental stimulation, and technology for dementia care and for transportation and mobility. Technology for personalized health monitoring, technology for remote caregiving, technology for social engagement and mental stimulation, technology for smart home solution, technology for care coordination and communication will be developed in the near future. These are technology for holistic care for elderly, telehealth and remote monitoring, AI, power personalization, robotic and automation, virtual reality and therapy and engagement, and also technology for on-demand services and platform. Moreover, technology for holistic care for the senior people will be covered in terms of cognitive stimulation and mental well-being technology, nutrition and wellness, transportation and mobility services for improving access to care and social activity. Technology for financial management too will be have to control. This is the example of smart medical device and healthcare technology. This is the example of robotic and artificial intelligence or AI for social engagement. This is the technology for personnel management. Technology for personalized medication management. In conclusion, about the technology for elderly care. All of the proposed technologies for the elderly are considered holistic healthcare for elderly, so that the elderly do not become a burden. And this is considered a new paradigm of care for the elderly that focus on changing the elderly to be a power for the country, not a burden anymore. Thank you so much.